Hi, I'm Dr. Greg Cason for WebbyHealth.com. At one time or another, everyone knows someone who's depressed or upset. But how do you know when their problems are more than just normal and the person needs help? Well, if someone you know is suffering from an emotional or mental disorder, there are many things you can do. The first is to recognize there's a problem. Now, although you may rarely see them, some behaviors may indicate an extreme emotional distress and a need for urgent care. These things which you need to pay attention to are highly disruptive behaviors such as being hostile or physically violent, an inability to communicate clearly such as garbled or slurred speech, loss of contact with reality such as seeing or hearing things which aren't there, overtly suicidal thoughts such as saying the world is better off without them, and homicidal thoughts such as expressing the intent to kill another person. If you have a friend or coworker who's doing one of these things, try to stay as calm as possible. It's best to find someone to stay with that person while the calls to the appropriate authority are being made. Now, if that person's in serious danger of harming him or herself or other people, call 911 immediately. If the situation's not life-threatening, then you may want to contact a family member, school or work security, or a crisis line for more assistance. But most problems are not that dramatic. Sometimes it's more of a pattern of behaviors that may indicate significant emotional distress. Things such as sudden extreme changes in behaviors, such as isolation or not showering. An extreme emotional response that's unusual for the situation, such as blowing up about a missed television show. Serious declines in school or work performance, not eating or sleeping, being excessively talkative or active, and avoiding people and things that they used to enjoy, and dramatic changes in the way they dress or do their hair. Now, in dealing with a friend or coworker, you have several choices. You can choose not to deal with it at all, or you can choose to deal with the situation on a more personal level. Now, if you choose to deal with it personally, think about the following. Speak privately with the person. Don't try to be judgmental. And in fact, try saying something like, "I've noticed you've been late for work and I'm concerned," rather than saying something like, "Where have you been lately, goofing off again?" Listen sensitively to your friend. Don't jump to conclusions or offer quick solutions. Rather, repeat back what the person is presenting to you and let them talk while you listen. Help analyze solutions to the problem as they see it. Clarify the costs and benefits of each option from the other person's point of view. And respect the person. Avoid judging, evaluating, or criticizing. Respect the person's value system, even when you don't agree with it. Now, even though someone asks for help with a problem and you're willing to help, there are circumstances that suggest that they need a professional, especially if you could not be objective enough to be of help. Now, some people accept a referral more easily than other people. The best referral is one to which the person will respond. And depending on the situation, have the person consider talking more with their friends and family, their doctor, clergy, and perhaps a mental health professional. The important thing is that they're doing something about it. I'm Dr. Greg Cason for WebbyHealth.com, your source for health tips, medical answers, and your overall guide to well-being.